Hello, this is Dr. Valentina Pasquantonio. I'm speaking to you for OHP4C, which is the Oral Health Posse for Consumers. This will be our last presentation, and I wanted to share with you something very important during this time. It is January the 10th, 2022. We're still in COVID mode. There's a lot of stories there, but we're going to instead focus on dentistry because, after all, that's what OHP4C was all about. It was about helping consumers to make wise choices in oral health. So what I want to do tonight, and it is night, is to share with you a rule. It's called the 90-10 rule. And this is a very important rule and can help you as a consumer. The 90-10 rule says, and it is correct, that 10% of oral health happens in a dental office and 90% of dental health happens at home. Wow. So you never have to go to the dentist again. Now, I didn't say that. What I did say is that 90% of oral health happens at home. What you do at home is 90% of the cure of keeping yourself healthy. Now, the problem is that nobody ever tells us how to do this. We have a lot of people who make a lot of money, I should say companies who make a lot of money, trying to sell you things that tell you that you will have oral health if you buy their product. Most of it is incorrect. You have a lot of preconceived notions that go back to nothing of any value. The real way to know how to take care of your mouth, how to take care and have good oral health, the way to find that out is from your dentist and your hygienist. Unfortunately, your hygienist and dentist don't get to see you much. And when you're there, you're not usually honed in on learning about the 90%. To add insult to injury, even though your dentist and your hygienist know exactly what you have to do at home, the insurance industry has no incentive to help you learn. Their contracts are only for 1 year and they don't care. Sometimes they're for 3 years, but they still don't care. Prevention, helping you to stay healthy, is not what they're about. What they're about is selling you insurance and making you think that you're getting a deal. So insurance companies don't cover oral health teachings. If you really want to be a good consumer, if you really want to understand how to have a healthy mouth, the one thing that you can do is call up your dental office and say, I want to have a half to 3/4 of an hour with the hygienist and the dentist. I will pay for it. Unfortunately, you would have to pay for it. But I want to know how to take care of my mouth on a daily basis. And when you go to that appointment, you don't want to ask, what kind of toothpaste should I use? That isn't important. You don't want to use, what kind of toothbrush should I use? That's not one of the questions you want to ask. The question you want to ask is, what do I do to keep my teeth and my mouth healthy? If they tell you that they want you to use a specific kind of toothbrush, then they should have it there, or you should have it with you when you get there. And they shouldn't just tell you how to do it, and they shouldn't just explain it, and they shouldn't just show you. They should have you do it until you understand how to do it in your mouth. Because as a dentist, I've got great hands and I can make anything work in somebody's mouth. But that doesn't mean that you can make it work in your mouth. You need the training, and that means that somebody has to spend some time teaching you. If you know how to play chopsticks, somebody had to show you how. This is a little bit more complex than chopsticks, but it's the same kind of thing. Somebody has to show you how, and you have to try. And usually you have to try with them there to help you along. Same thing with flossing or using other materials to clean your teeth. How you hold the floss. Actually do it in the office. Actually have them watch you floss every single one of your teeth, because you're going to have different positions for all of them. Make sure that you understand how to wrap it. All of those things are so important. They take less than 2 minutes, cost less than probably what you're paying right now. And yet that 90% of health can be taken care of in that one appointment when somebody who truly understands how to do it shows you how. I got into dentistry because I knew there had to be a better way. I was, let's say, traumatized as a child. And the most dental education I ever got was a dentist patting me on the top of the head saying, "You need to brush more." And I took his advice. I brushed more. With my favorite toothbrush that my godmother had given to me before she died 4 years prior to that. In other words, the brushing was not helpful because the bristles were gone. Most of us are smart enough to understand that at this point in time, but as a 7 or 8 or 9-year-old child, I did not. We need to hold our dental team accountable. That means we have to ask them to show us how in our own mouths. And if that means you have to pay for it, pay for it. It will be the best money you have ever spent. The most preventive measures you have ever taken. Please do it. I thank you for your time. As I have said, OHP4C is going away. Yours truly is going to spend a whole lot of time, I've already started, volunteering for non-partisan, non-profit organizations to help further a very basic human right according to the United Nations, and that is universal health coverage for every human being. Thank you for your help. Remember always that when you're watching these things on YouTube, because even though OHP4C is going away, this video will be on for a while. Remember that you have to continue to learn from lots of different people, and that you have to know the source, and that you have to know when the source spoke the words. Go and get help. Go and get your dental professionals to show you how to take care of your teeth at home, because 90% of your oral health happens at home. And if they don't want to do it, well, between you and me, get a new dentist. Thank you. Goodbye now.